The slow rollback of pandemic restrictions in New Hampshire continues with an easing of quarantine rules. Now, if you've been exposed to COVID-19 in the community, you no longer have to quarantine. However, if the exposure is within your own home, the recommendation to quarantine still stands. With COVID numbers still gradually dropping, the state has let its contact tracing operation lapse.
We're not going to continue to do community contact tracing, meaning if a case says that they ate at a restaurant on a certain day or in their workplace while they were potentially infectious, we're not going to go ahead and conduct that investigation and notify those people.
HHS will monitor the spread of the virus, but only in certain instances.
We will continue to investigate all cases of COVID-19 that gets reported to our office, and we're also going to continue to respond to any suspected outbreaks when we see 3 or more cases associated with the same location.
Health officials are also still keeping track of COVID variants of concern, like the highly contagious Delta variant. So far, there have only been 13 known cases in New Hampshire, and the vaccine has proven effective against it.
If something were to change, if it looked like the vaccine wasn't as viable against an aggressive variant, we could take a look at that, and we'd make an assessment as to what steps need to be taken. The good news is we have a lot of tools in the toolbox.
While the state is winding down its efforts, there are still some ongoing initiatives. The homebound vaccination program has reached 5,025 Granite Staters who cannot leave their homes. There are just 53 people left on that list. Reporting live in Concord, Adam Sexton, WMUR News 9.